Okay, here we go. All right, so the first question. When the nurses teaches a skill such as self-injection of insulin to the patient, what is the best way to set up the teaching learning session? And if you guys want to write these down, you can. If you want to yell them out, you can. If you don't want to answer, that's fine too. We're just going to go through each answer pretty quickly so that it doesn't take all day, okay? The answer to this is D. Remember, a return demonstration or the teach back method. This allows the nurse to evaluate that the patient's able to perform the newly learned skill properly, right? Best way for them to show you is that they can do it is to actually do it in front of you. Number 2, the nurse is administering insulin, Lispro Humalog, and will keep in mind that this insulin will start to have an effect within which time frame? And the answer to this is going to be A. Remember, this is rapid acting, so the onset is within 15 minutes. Really important for those patients that are hospitalized, that you have their tray present before you administer the insulin so that they have something to eat. Otherwise, they may become hypoglycemic. Number 3, the nurse recognizes that use of estrogen drugs is contraindicated in which patient? And the answer is going to be D, a woman with a history of thrombophlebitis. So any kind of drug that contains estrogen is contraindicated in somebody that has a history of clotting disorders. And that goes for estrogen therapy for peri and postmenopausal, as well as contraception or contraceptives. Number 4, a patient newly diagnosed with hypothyroidism receives a prescription for a thyroid hormone replacement drug. The nurse assesses for which potential contraindication to this drug. And the answer to this is D. There is a contraindication to thyroid preparations for any known allergy or a recent myocardial infarction. Five. When administering a new medication to a patient, the nurse reads that it's highly protein bound. Assuming that the patient's albumin levels are normal, the nurse would expect which result as compared to a medication that is not highly protein bound. It's making you think back to the very beginning, isn't it? And the answer is going to be D. Drugs that are bound to plasma proteins are characterized by longer duration of action. 6, during a routine checkup, a patient states that she is unable to take the prescribed antihistamine because of one of its most common adverse effects. The nurse suspects that which adverse effect has been bothering this patient. And the answer is going to be C, drowsiness. That's usually the chief complaint of people that take antihistamines. It's also one of the reasons it's used as a sleep aid, right? A lot of people take Benadryl to help them sleep. 7, when discussing dosage calculation for pediatric patients with a clinical pharmacist, the nurse notes that which type of dosage calculation is used most commonly in the pediatric calculations. And the answer is D. Remember, it's milligram per kilogram formulas based on body weight. That is the most common form for the pediatric clientele. 8, A patient who is diagnosed with shingles is taking topical acyclovir and the nurse is providing instructions about adverse effects. The nurse will discuss which adverse effects of topical acyclovir therapy. And the answer is C, burning when it is applied. Transient burning may occur with topical application. Nine, when a patient is taking an adrenergic drug, the nurse expects to observe which effect? Remember, adrenergic drugs stimulate the sympathetic nervous system, right? So the answer is going to be A, an increased heart rate as one of the effects. May also cause bronchodilation, dilated pupils, decreased GI mobility. 10. The nurse is administering a stat dose of epinephrine. Epinephrine is appropriate for which situation? And the answer is going to be C, cardiac arrest. Whoops, sorry. 11. The nurse working in a preoperative admitting unit administers an anticholinergic medication to a patient before surgery. What is the purpose of this drug in the preoperative setting? And the answer is D, to reduce oral and GI secretions. This helps prevent aspiration while the patient is intubated during surgery. The nurse is monitoring a patient for signs and symptoms of hyperkalemia if the patient is taking which of these diuretics? So you would be looking for a potassium sparing diuretic, right? And that answer would be D, spironolactone or aldactone. It is a potassium sparing diuretic, and you need to monitor your patients that are taking it for signs and symptoms of hyperkalemia. "13, in assessing a patient before administration of a cardiac glycoside, the nurse knows that which lab result can increase the toxicity of the drug? So if you remember, our prototype for a cardiac glycoside is digoxin, right? And we are going to monitor for their potassium level because hypokalemia, or a potassium level of 2.8 increases the chances of getting digitalis toxicity. "14, the nurse will monitor for which adverse effect when administering an anticholinergic drug? And the answer is C, a dry mouth. Typically, adverse effects include not only dry mouth, but blurred vision, constipation, urinary retention. "15, the nurse notes in the patient's medication orders that the patient will be starting anticoagulant therapy. What is the primary goal of anticoagulant therapy? And the answer is C, to prevent thrombus formation. Remember, anticoagulants prevent further thrombus. It is not a thrombolytic. It does not break up a clot that's already there. 16. The nurse is teaching a patient about the adverse effects of fertility drugs such as clomiphene or Clomid, which is a potential adverse effect of this drug. Headache, so A is the correct answer. That's just one of the possible adverse effects of most fertility drugs. They can also cause vomiting, restlessness, and itchiness. When counseling a male patient about the possible adverse effects of antihypertensive drugs, the nurse will discuss which potential problem. And the answer is A, impotence. Sexual dysfunction is a common complication of antihypertensive medications and may be manifested in men as decreased libido. Make sure that you educate your client that if they're having these issues, to speak with their healthcare provider, because we can try other medications that maybe they won't have the same issues. It's one of the common adverse effects that clients will just absolutely stop taking the medication, and then they end up with rebound hypertension, which is never good. Okay, 18. How are you guys doing so far? 8. Am I going too fast or is it okay? All right. A patient who has recently started therapy on a statin drug asks the nurse how long will it take until he sees an effect on his serum cholesterol. Which statement would be the nurse's best response? And the answer is B. It does take 6 to 8 weeks to see a change in cholesterol levels. A patient who has been anticoagulated with warfarin, Coumadin, has been admitted for GI bleeding. The history and physical examination indicate that the patient may have taken too much warfarin. The nurse anticipates that the patient will receive which antidote? And you guys are super smart, so you know that the answer is B, vitamin K for warfarin. It is given to reverse the anticoagulation effects of warfarin toxicity. Remember, protein sulfate is, protamine sulfate is for heparin overdose. A patient is started on a diuretic for antihypertensive therapy. The nurse expects that a drug in which class is likely to be used initially? And the answer is C, your thiazide diuretics. These are the ones that we use as first-line treatment for hypertension. The other ones we may use, but not considered first line. When applying transdermal nitroglycerin patches, which instruction by the nurse is correct? The answer is going to be A, rotate application sites with each dose, apply them to any non-hairy area of the body, and the old patch should be removed first. The patch can be worn while swimming, but if it comes off, it should be replaced after the old site is cleaned. During an assessment, the patient tells the nurse that he eats large amounts of garlic for its cardiovascular benefits. Which drug or drug class, if taken, would have a potential interaction with the garlic? And the answer to this is B, insulin. The use of garlic may interfere with hypoglycemic drugs. The nurse is reviewing the mechanism of action of cholinergic drugs. The undesired effects of cholinergic drugs come from the stimulation of which receptors? And the answer is B, nicotinic. Many of the undesirable adverse effects are due to the nicotinic receptor stimulation. Remember, your desired effects come from muscarinic receptor stimulation. And I always remember this because nicotine is bad, right? So nicotinic is the bad, undesirable effects. Okay, 24. A patient is receiving heparin therapy as part of the treatment for a pulmonary embolism. The nurse monitors the results of which laboratory test to check the drug's effectiveness. So we're talking about the fit therapy. How do we make sure that heparin is therapeutic? And the lab that we look at for heparin is B, the activated partial thromboplastin time, or the APTT. PT-INR is used to monitor your warfarin therapy, remember? And sometimes we do use heparin as a bridge to warfarin therapy. 25, the nurse notes in the patient's medication history that the patient is taking cyclobenzaprine Flexeril. Based on this finding, the nurse interprets that the patient has which disorder? So this is going way back, right? So you guys remember that Flexeril is a muscle relaxer. It's a muscle relaxant, most commonly used to help with reduced spasms following musculoskeletal injuries. So you would think A, that the patient has a musculoskeletal injury. While a patient is receiving anti-lipemic therapy, the nurse knows to monitor the patient closely for the development of which problem? And the answer is D. These drugs can adversely affect your liver function. Therefore, your liver function studies need to be closely monitored. And that would be your AST and your ALT, right? Those are your liver function labs. When evaluating a patient's use of a metered dose inhaler, the nurse notes that the patient is unable to coordinate the activation of the inhaler with her breathing. What intervention is most appropriate at this time? And the answer is C, obtain an order for a spacer device. This can also be used in your pediatric patients. 28. A patient is taking nystatin oral lozenges to treat oral candidiasis infection resulting from inhaled corticosteroid therapy for asthma. Which instruction by the nurse is appropriate? And the answer is B, let the lozenge dissolve slowly and completely in your mouth without chewing it. Need a drink. A 75-year-old woman with type 2 diabetes has recently been placed on glipizide, glucotrol 10 milligrams daily. She asked the nurse when the best time would be to take this medication. What is the nurse's best response? And the answer is A. Remember, you take glipizide in the morning, 30 minutes before breakfast. That way it has a longer duration of action. Metformin is taken with meals.
Professor, I think we skipped 29.
Oh, did we?
Yeah.
We sure did, didn't we? 29. A patient is going home with a new prescription for the beta blocker atenolol. The nurse will include which content when teaching the patient about the drug? The answer is going to be A, never stop taking this medication abruptly, not only because of the rebound hypertension that we already talked about, that clients taking beta blockers, if they stop them abruptly, may have actual chest pain with an abrupt withdrawal. All right, 31. A patient is taking the non-steroidal anti-inflammatory drug indomethacin, Indocin, as treatment for pericarditis. The nurse will teach the patient to watch for which adverse effect? And the answer is going to be C. We know that NSAIDs, all NSAIDs, right, have GI effects that include dyspepsia, heartburn, epigastric distress, nausea, vomiting, abdominal pain. And it goes on and on, right? 32. During a period of time when the computerized medication order system was down, the prescriber wrote admission orders and the nurse is transcribing them. The nurse is having difficulty transcribing one order because of the prescriber's handwriting. Which is the best action for the nurse to take at this time? And the answer is B, contact the prescriber to clarify the order. Anytime you don't understand something, whether it's written or in verbal form, you need to ask for clarifications. 33. An 83-year-old woman has been given a thiazide diuretic to treat mild heart failure. She and her daughter should be told to watch for which problems? And the answer is going to be B, fatigue, leg cramps, and dehydration. Electrolyte imbalances, leg cramps, fatigue, and dehydration are all common complications when you're giving thiazide diuretics to the elderly. Remember, they have less fluid than young children or young adults. And so they're more susceptible to fluid changes. And they would also be put on fall precautions, right? They would be at high risk for falls. 35. Nope, 34, just kidding. A patient has a diagnosis of primary hypothyroidism. Which statement accurately describes this problem? And the answer is C. The abnormality is in the thyroid gland itself, and it occurs when the thyroid gland is not able to perform one of its many functions. Remember, secondary hypothyroidism begins at the level of the pituitary gland and results from reduced secretion of thyroid stimulating hormone, or TSH. TSH is needed to trigger the release of T3 and T4, which is actually stored in the thyroid gland. 35. When teaching about hypoglycemia, the nurse will make sure that the patient is aware of the early signs of hypoglycemia, which include and the answer is C, confusion and sweating. I know I said this the other day, but cold and clammy, need some candy, hot and dry, sugar's high. That helps you discern whether it's hypo or hyperglycemia. So early symptoms of hypoglycemia are going to include central nervous system manifestations such as confusion, irritability, tremors, and sweating. $36. A patient who has been taking antihypertensive drugs for a few months complains of having a persistent dry cough. The nurse knows that this cough is an adverse effect of which class of antihypertensive drugs? And the answer is B, B, ACE inhibitors. They cause that characteristic dry, non-productive cough, and it typically reverses as soon as the therapy is stopped. 37. A patient who has a history of coronary artery disease has been instructed to take 1 80-milligram aspirin tablet a day. The patient asks about the purpose of this aspirin. Which response by the nurse is correct? And the answer for this is D. Aspirin can reduce platelet aggregation, so it helps prevent clots. Low doses of aspirin, 81 to 325 milligrams once a day, are used for thromboprevention. 38. A patient will be receiving a thrombolytic drug as part of the treatment for acute myocardial infarction. The nurse explains to the patient that this drug is used for which purpose? And the answer is C, to dissolve the clot in the coronary artery. Remember, thrombolytic drugs actually lyse or dissolve the clot or the thrombi, okay? They're not used to prevent further clot formation or to control bleeding. That's why we use anticoagulants. 39. The nurse has been monitoring the patient's progress on a new drug regimen since the first dose and documenting the patient's therapeutic response to the medication. Which phase of the nursing process do these actions illustrate? And you guys know your ADPI, and this would be D, right? Evaluation. Monitoring the patient's progress, including their response to the medication, is all part of the evaluation phase. The nurse will assess the patient for which potential contraindication to anti-tubercular therapy. And the answer is D, hepatic impairment. Remember, isoniazid and rifampin can cause hepatic impairment already. So if you have severe liver dysfunction, you're not going to be taking these medications. #41. The nurse is developing a care plan for a patient who will be self-administering insulin injections. Which statement reflects a measurable outcome? And the answer is C, the patient will demonstrate the proper technique of self-administering insulin injections. The word demonstrate is a measurable verb, and you need measurable terms when used in developing goals and outcomes for your client's education. 42. The nurse is about to administer a stat dose of intravenous atropine sulfate to a patient who is experiencing a symptomatic cardiac dysrhythmia. During administration of the drug, the nurse will monitor the patient closely for which adverse effect? And the answer is A, tachycardia. The cardiovascular effects of cholinergic blockers include increased heart rate and dysrhythmias, right? We know that we give atropine to increase the heart rate. #43. If a patient is taking fluconazole or diflucan with an oral anticoagulant, the nurse will monitor for which possible interaction? And the answer is B, an increased effect of the oral anticoagulant. So the azole antifungal drugs increase the effects of oral anticoagulants. As a result, increased bleeding may occur, so you want to closely monitor those patients. "44. When teaching a patient who is starting metformin or glucophage, which instruction by the nurse is correct?" And the answer is D, take the medication with food to reduce the gastrointestinal effects. 45. When monitoring a patient who is taking a systemically administered glucocorticoid, the nurse will monitor for signs of which condition? The answer is going to be B. Systemic glucocorticoids cause potassium depletion, hyperglycemia, and hypernatremia. And remember, it causes hyperglycemia in everyone, not just your diabetic patients. 46. The nurse is teaching a patient who will be taking a proton pump inhibitor as long-term therapy about potential adverse effects. Which statement is correct? And the answer is D. Long-term use of these drugs may contribute to osteoporosis. 47. A patient is to receive testosterone therapy via a transdermal patch. He asks the nurse, "Why am I getting a patch? Can't I just take a pill?" Which response by the nurse is correct? The answer is C. The patch allows for better absorption of the medication. A transdermal form allows for better absorption of testosterone because of its high first pass effect. Oral forms are poorly absorbed, and transdermal is preferred to injections.
I'm sorry, which one was it? What was the answer again? I'm so sorry.
C.
Okay, thank you.
Mhm.
So are injections just less effective?
No, the injections are just as effective as the patch, but there's a lot that goes on with having to do self-injections, right? A patch is a lot more user-friendly for outpatient use. So
Gotcha.
okay, take a drink. Excuse me. Okay, I think we're about halfway done. 48. A patient is taking digoxin and a loop diuretic daily. When the nurse enters the room with the morning medications, the patient states, "I'm seeing a funny yellow color around the lights." What is the nurse's next action? And you guys know that this is a sign or a symptom of digoxin toxicity, right? And whenever your patient's taking digoxin with a loop diuretic, which can deplete potassium, it puts them at higher risk for digoxin toxicity. So the answer is A. You're going to assess the patient for symptoms of digoxin toxicity. May have other signs and symptoms such as bradycardia, a headache, dizziness, confusion, nausea, and you definitely want to notify the prescriber. They'll probably order a digoxin level to see where they're at. 49. A patient newly diagnosed with hypothyroidism has received a prescription for thyroid replacement therapy. The nurse will instruct the patient to take this medication at which time of day? And the answer is A, in the morning. typically taken at least 30 minutes before food with a full glass of water. A patient with gout has been treated with allopurinol for 2 months. The nurse will monitor laboratory results for which therapeutic effect. So clients take allopurinol to reduce uric acid. And so you're going to notice a decreased uric acid level if the allopurinol has been effective. So the answer is A. Treatment of gout with your allopurinol should result in decreased uric acid levels. Which action is most appropriate regarding the nurse's administration of a rapid-acting insulin to a hospitalized patient? And the answer is A, give it within 15 minutes of mealtime. Remember, it can it's rapid acting and it's gonna come in effect within 15 minutes. So you wanna make sure that the patient has their food available. After receiving a nebulizer treatment with a beta agonist, the patient complains of feeling slightly nervous and wonders if her asthma is getting worse. What is the nurse's best response? The answer is A. This is an expected adverse effect. Let me take your pulse. Remember that they cause tremors, cardiac stimulation, they can become tachycardic, maybe that nervous feeling. So it is an expected adverse effect. But you also want to assess your patient to make sure that it's not, the heart rate isn't too high, right? A patient about to receive a morning dose of digoxin has an apical pulse of 53 beats per minute. What will the nurse do? And the answer is D, withhold the dose and notify the prescriber. Hang on just a second. Oh, sorry about that. Okay, 54. During drug therapy with a tetracycline antibiotic, a patient complains of some nausea and decreased appetite. Which statement is the nurse's best advice to the patient? And the answer is D. Oral doses should be given with at least 8 ounces of fluids and food to minimize the GI upset. However, antacids and dairy products will bind with tetracycline and make it inactive. A patient who has been on long-term corticosteroid therapy has had surgery to correct an abdominal hernia. The nurse keeps in mind that which potential effect of this medication may have the most impact on the patient's recovery. And the answer is B, delayed wound healing. Sorry, I keep getting a tickle in my throat. It can cause muscle weakness and osteoporosis, but delayed wound healing would be the best answer when we're talking about a post-operative patient healing. A patient who has been taking isoniazid has a new prescription for pyridoxine. She's wondering why she needs this medication. The nurse explains that pyridoxine is often given concurrently with isoniazid to prevent which condition? And the answer is C, peripheral neuropathy. It can be beneficial to help with that. 57, a patient wants to try an oral soy product to relieve perimenopausal symptoms. The nurse will assess the patient's medication history for which potential drug interaction. And the answer is A, thyroid replacement therapy. Orally administered soy can interfere with thyroid hormone absorption, so concurrent use must be avoided. '58. When giving dextromethorphan, the nurse understands that this drug suppresses the cough reflex by which mechanism of action? And the answer is C, having a direct action on the cough center. '59. A patient has been diagnosed with metabolic syndrome and is started on the guanide metformin. The nurse knows that the purpose of the metformin in this situation is which of these? And the answer is B, to decrease insulin resistance. While recovering from surgery, a 74-year-old woman started taking a stimulant laxative, Senna, to relieve constipation caused by the pain medications. 2 weeks later, at her follow-up appointment, she tells the nurse that she likes how regular her bowel movements are now that she is taking the laxative. Which teaching principle is appropriate for this patient? And the answer is C. Long-term use of laxative often result in decreased bowel tone and may lead to dependency. So you don't necessarily need to have a bowel movement every day. If she wants to take something every day, she should take a bulk forming supplement, because those are the ones that are safe to take every day. A patient is at an urgent care center with an acute asthma attack. The nurse expects that which medication will be used for the initial treatment? And the answer is B, a short-acting beta-2 agonist such as albuterol. Those are the ones that we use during an acute asthma attack. '62, after starting treatment for type 2 diabetes 6 months earlier, a patient is in the office for a follow-up examination. The nurse will monitor which laboratory test to evaluate the patient's adherence to the anti-diabetic therapy over the past few months. And the answer is B, the hemoglobin A1C level. This reflects the patient's adherence to therapy over the several previous months. '63, a patient has been prescribed warfarin in addition to a heparin infusion. The patient asks the nurse why he has to be on 2 medications. The nurse's response is based on which rationale? The answer is D, heparin is used to start anticoagulation. so as to allow time for the blood levels of warfarin to reach therapeutic or adequate levels. The nurse recognizes that adrenergic drugs cause relaxation of the bronchi and bronchodilation by stimulating which type of receptors? And it's C, beta 2 adrenergic receptors results in bronchodilation. Remember, beta 2 is your 2 lungs, beta 1 is 1 heart. So your cardiac selective are beta 1. 65. A patient is receiving his 3rd IV dose of a penicillin drug. He calls to the nurse to report that he's feeling anxious and is having trouble breathing. What will the nurse do first? And you guys are good nurses, so you stop the antibiotic infusion. C. Hypersensitivity reactions are characterized by wheezing, shortness of breath, swelling of the face, tongue, hands, itching or rash. Immediately stopping the antibiotic infusion is the first thing. Have someone notify the prescriber, stay with the patient, monitor their vital signs. And then documenting that the patient had a reaction. The nurse is teaching a group of patients about management of diabetes. Which statement about basal dosing is correct? And the answer is A, basal dosing delivers a constant dose of insulin. Your basal bolus therapy is supposed to mimic a healthy pancreas, so it delivers that basal insulin constantly. 67. A 19-year-old woman has been diagnosed with hypothyroidism and has started thyroid replacement therapy with levothyroxine. After 6 months, she calls the nurse to say she feels better and she wants to stop taking the medication. Which response by the nurse is correct? And the answer is D. Medication therapy for hypothyroidism is usually lifelong, and you should not stop taking the medication, especially abruptly. When reviewing the health history of a patient who will be receiving antacids, the nurse recalls that antacids contain magnesium need to be used cautiously in patients with which condition? And the answer is B, renal failure. Both calcium and magnesium-based antacids are more likely to accumulate at toxic levels in those that have renal disease, and commonly are avoided because of that. 69. When a male patient is receiving androgen therapy, the nurse will monitor for signs of excessive androgens, such as, the answer is A, fluid retention. This is an undesirable effect of androgen therapy. A patient asks the nurse about the difference between diphenoxylate with atropine, Lamodal, and the over-the-counter drug loperamide, Imodium. Which response by the nurse is correct? And the answer is B, Imodium does not cause physical dependence. '71. An 18-year-old basketball player fell and twisted his ankle during a game. The nurse will expect to administer which type of analgesic? And the answer is D, a non-opioid analgesic such as indomethacin. These are best to treat somatic pain. So think of your skeletal muscles, ligaments, and joints. The nurse is administering medications to the patient who is in renal failure resulting from end-stage renal disease. The nurse is aware that patients with kidney failure would most likely have problems with which pharmacokinetic phase? And the answer is D, excretion. Remember, your kidneys are the organs that are most responsible for drug excretion. '73, which nursing diagnosis is appropriate for a patient who has started aminoglycoside therapy? And the answer is B, risk for injury or renal damage. Remember, these are nephrotoxic drugs, so they have an increased risk for injury to the kidneys. '74, a hospitalized patient is experiencing a severe anaphylactic reaction to a dose of IV penicillin. Which drug will the nurse expect to use to treat this condition? And the answer is B, epinephrine. This is the drug of choice for the treatment of anaphylaxis. '75. When monitoring a patient who is taking hydrochlorothiazide, the nurse notes that which drug is most likely to cause a severe interaction with the diuretic? We kind of already talked about this. The answer is A, digitalis, because there's an increased risk for digitalis toxicity in the presence of hypokalemia, and hydrochlorothiazides can cause hypokalemia. '76, the nurse notes in a patient's medication history that the patient is taking allopurinol. Based on this finding, the nurse interprets that the patient has which disorder? The answer is B, gout.
I have a question. So back for number 75, the potassium supplement, that wouldn't be, it wouldn't be, because it's a diuretic, right? So a potassium supplement would secrete even more. Can you just repeat like the reasoning?
Okay, so let's read the question again, okay? When monitoring a patient who is taking hydrochlorothiazide, the nurse notes that which drug is most likely to cause a severe interaction with the diuretic? We know that hydrochlorothiazide depletes your potassium stores, and we know that digitalis in the presence of hypokalemia can cause toxicity, okay? The potassium supplements are going to actually help prevent hypokalemia. Does that make sense?
Yeah, I read it wrong then, because yeah, the potassium supplement would help I don't know why I was thinking potassium sparing, but
yeah, no, you're right.
Okay.
All right, where were we?
Thank you.
77. The prescriber has changed the patient's medication regimen to include the leukotriene receptor antagonist montelukast singular to treat asthma. The nurse will emphasize which point about this medication? And the answer is C, it needs to be taken every day on a continuous schedule, even if the symptoms improve. So this is indicated for chronic Asthma has to be taken every day. If the symptoms improve, it's because you're taking the medication every day and you shouldn't stop taking it, right? Kind of like your blood pressure medicine. 78. A 6-year-old child who has chickenpox also has a fever. The child's mother asked the nurse if she should use aspirin to reduce the fever. What is the best response by the nurse? And the answer is C, acetaminophen or Tylenol should be used to reduce his fever, not aspirin. Use of aspirin in children with flu-like symptoms has been associated with Reye's syndrome, which is an acute and potentially life-threatening condition. So typically we just try to use Tylenol for kids. 79, a patient with a history of chronic obstructive pulmonary disease and type 2 diabetes has been treated for pneumonia for the past week. The patient has been receiving intravenous corticosteroids as well as antibiotics as part of his therapy. At this time, the pneumonia is resolved, but when monitoring the blood glucose levels, the nurse noticed that the level is still elevated. What is the best explanation for this elevation? And the answer is B, the corticosteroids may cause an increase in glucose levels. The nurse is reviewing the use of anticholinergic drugs. Anticholinergic drugs block the effects of which nervous system? And the answer is D, the parasympathetic nervous system, right? They're going to inhibit the actions of acetylcholine. A patient has been taking a beta blocker for 4 weeks as part of his anti-anginal therapy. He also has type 2 diabetes and hyperthyroidism. When discussing possible adverse effects, the nurse will include which information? And the answer is D. Beta blockers can cause both hypo and hyperglycemia. And so you should monitor your blood glucose levels if you're taking a beta blocker. All right, now we're going to get into the select all that apply. All right, number 1. The nurse is reviewing the use of oral laxatives. Which conditions are general contraindications to or cautious about the use of oral laxatives? Select all that apply. Okay, so the answer is going to be undiagnosed abdominal pain, nausea and vomiting, fecal impaction, and acute surgical abdomen. Hang on just a second, I need to shut the door. Okay. A patient is taking a sulfonylurea medication for new onset type 2 diabetes mellitus. When reviewing potential adverse effects during patient teaching, the nurse will include information about which of these effects. And the answers are hypoglycemia, nausea, and weight gain. During antibiotic therapy, the nurse will monitor closely for signs and symptoms of a hypersensitivity reaction. Which of these assessment findings may be an indication of a hypersensitivity reaction? And the answers are A, wheezing, C, shortness of breath, D, swelling of the tongue, and E, itching. A patient is on a chemotherapy regimen in an outpatient clinic and is receiving a chemotherapy drug that is known to be highly emetogenic. The nurse will implement which interventions regarding the pharmacologic management of nausea and vomiting? Okay, the answers are B, administering the anti-nausea drugs 30 to 60 minutes before the chemotherapy is started. Instructing the patient that anti-nausea drugs may cause extreme drowsiness, E. And F, instructing the patient to rise slowly from a sitting or lying position because of possible orthostatic hypotension. Five, place the phases of the nursing process in the correct order, with 1 as the first phase and 5 as the last phase. And everybody knows that this is AdPi, so. Six. The nurse can prevent medication errors by following which principles? And the answer is use 2 patient identifiers before giving medications. Do not give a medication that another nurse has drawn up in a syringe, and minimize the use of verbal and telephone orders. Of course, we're going to assess for allergies, but we're going to do it before giving medications, right? Seven, the nurse is providing patient teaching about antacids. Which statements about antacids are accurate? And the answer is B. Antacids neutralize acid in the stomach. C, rebound hyperacidity may occur with calcium-based antacids. And E, magnesium-based antacids cause diarrhea. Okay.
Is aluminum not one? I thought it was aluminum, magnesium, and calcium.
Aluminum
I-
is an antacid,
Uh-huh.
but it doesn't cause diarrhea.
Okay.
Okay. I always remember that it's the magnesium that causes diarrhea because, you know, in that little bottle, you get mag citrate as a laxative. So. All right. 8, the nurse is reviewing the indications for atropine sulfate. Atropine is appropriate for which of these patients? The answers are A, a patient who has suddenly developed symptomatic bradycardia with a heart rate of 32. D, a patient who's about to have surgery. And F, a patient with anticholinesterase inhibitor poisoning. So. The other options that are listed are actually contraindications to the use of atropine. You don't want to give it to those that have glaucoma, myasthenia gravis, or someone who has tachycardia. Number 9, the nurse is reviewing medications for the treatment of asthma. Which drugs are used for acute asthma attacks? And the answer is B, albuterol, and C, epinephrine. So albuterol, remember that's your short-acting beta-2 agonist, and epinephrine helps with bronchospasms if it's progressed that far. So those are the only 2 that you would use in acute situation. The rest would be used as chronic management of asthma. Stop sharing.